Do you have difficulty getting up from the floor or your bed due to weak abdominal muscles such as postpartum, C-section, diastasis recti, umbilical hernia with one side low back pain, and you ended up lying on your side first, pushing through your elbows in order to get up? Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. If you're new to my channel is about Pilates, yoga, physical therapy, health and wellness, and in this video, I'll be demonstrating a lovely, deep core activating, safe for anyone with back pain or anyone with diastasis recti, umbilical hernia, and postpartum, and you need to strengthen your core safely and effectively utilizing ankle weights. If you don't have ankle weights, you can still join me, especially for those absolute beginners who can't even lift their legs up from the floor. So get your mat ready and join me. My friends, if you have umbilical hernia, diastasis recti, or postpartum, or anyone in between of these, and you have low back pain on one side and you don't know how to strengthen your core muscles safely and effectively, then this video is for you. And also, I have a lot of exercises you can check out, and this is one of the best one I have. And if you want to learn, if you have this condition, this is a video you can also watch about that. What's the difference between diastasis recti and umbilical hernia? And I have a lot of 30-day challenges you can try as well. Always remember, you have to slowly build up your core strength. It's not like in a matter of one session, you're going to get stronger. You need consistency and a lot of discipline to make sure you can strengthen your core and your back safely and effectively. I would also recommend that you see your local doctor or physical therapist. See them first to make sure you are safe to do any exercises. If you are experiencing excruciating pain, stop. Make sure your exercises feel good, not the other way around. My program is safe and gentle, but doesn't mean it's safe for you. So that's why I recommend to make sure you have the right diagnosis, and these exercises are just adjunct to your current program if you have one already. But if you don't have one, you can also consult me with my upcoming Backmaster class. I'll be reopening at the end of the month, May 26, 2023, and I'm excited to meet my new students as they will register first come first serve basis on May 26 before I release this to the public. And for those who already signed up, then you'll get the direct email access from me on how to join. And if you don't want to miss out, click the link on the description below. Be part of the early bird waitlist for a first come first serve basis, because I only serve a small amount of students, so I can give the best health wellness advice I could give on your specific needs and specific needs of your overall health. So let's begin the program. Let's put around your ankles. And as I said earlier, you don't have to put ankle weights if you don't have one. And if you're absolute beginners, just doing this with me, you're going to feel a lot of massive work already. You're going to feel engagement on your core, proper breath work, and keeping your spine in neutral position. So place this around and make sure you did not eat anything before this program. Your stomach should be empty, and you can have a bottle of water. You can drink some water to hydrate yourself. But my best recommendation is to make sure you're not so full that you can't breathe properly, because we're going to lie down on your back. Slowly lie down with your knees bent. Place your hands behind your thighs so you can roll down safely. And if you can't roll down like this because of weakness, then you can lie on your side and roll, and then log roll back to your back. Okay, my friends, let's start engaging your breath work first. And keeping your spine in neutral position, placing your hand at the small of the back and one hand on your abdomen. Inhale. Make sure as you breathe in through your nose, and then you want to lower your diaphragm by really feeling it through your abdominal muscles expanding, and then imagining your pelvic floor engagement by trying to squeeze it in as you slowly breathe out through your mouth, and squeezing and lowering your belly button towards your spine while keeping your hand at the small of your back stable. You're not pressing it down. You want to make sure everything is in neutral, not overarching your spine and not flattening. Somewhere you can slide your hand gently and breathe out. Inhale again. Through your nose, exhale, squeeze your core in. Last one, inhale. and exhale. Now place your hands beside you and we're gonna start gentle bridging exercises. Bridging is a great way to start. As you lift, squeeze your core in, and if you have back pain in one side, making sure you're not creating more pain going down your legs, you're centralizing it on your spine, not down your buttocks. If it's causing pain on your buttocks, stop. Inhale, belly rise. Exhale, squeeze your core in and then roll down one vertebrae at a time. Inhale, lift. Belly rise as you lift. Engage your pelvic floor. Squeeze your belly button to your spine. Squeeze your glutes all at the same time. And then roll down one vertebrae at a time and breathe out. Inhale, lift. Belly rise. Squeeze your core in as you roll down. Bone to bone down to the mat and breathe out. Inhale. Belly rise. Exhale down. 2 more. Inhale. Belly rise. Exhale down. Last one, my friends. Inhale. Belly rise. Exhale, breathe out. So if you have one-sided pain, I want to make sure you focus on that painful area by really slowly lifting your glutes. Now, with your toes out to the side, we're going to do a little bit external rotation on your hips. So with a little bit opening, you're engaging your deep hip muscles. And we're going to lift. This will support your lumbar spine. Belly rise. Exhale down. Squeeze your core in. Inhale, lift. Belly button to your spine. Exhale down. Bone to the mat. Inhale, lift. Exhale down. 2 more. Bridge. Belly rise. Exhale, squeeze and roll down. Last one, my friends. Lift and squeeze and roll down. Well done. Now I want to engage deeper by bridging again. Hold that bridge and we're going to pulse up and down, small range of motion. Squeeze as you lift. Squeeze your buttocks as tight as you can. If you have a penny on your butt crack, you want to squeeze that penny. Squeeze up and small down halfway through. You don't want to go all the way down. Just small range up and down 10 times with your breath work. 10, 9, squeeze as hard as you can. 8, 7, 6, 5, 4, 3, 2, and 1. Whew. Well done. Now let's engage your hip flexors. As I said, I have a lot of videos discussing one side pain, and your hip flexors are so important to support your spine and your core muscles, the prime mover of the hips. So with your toes pointing away, a little bit external rotated by pointing away from you and a little bit diagonal. So you're gonna lower your hip down a little bit to the side and you're gonna lift up as much as you can. If it's not 90 degrees, that's fine. As you inhale, exhale, dorsiflex, which is pointing your toes towards you. And then exhale down, slow and steady. Don't plop. Controlled mind-body awareness and breathe out. Inhale up. And then exhale as you go down. Inhale up. Exhale down. 7 more. Breathe in. Breathe out. 6 more. 5. 4. 3. 2. And 1. Now let's switch to the other side. Bend your right knee, extend your left toes a little bit diagonal. Squeeze your core in. Belly rise first and squeeze. Toes up, dorsiflex, and exhale down. Squeeze your core in and breathe out. Inhale. Exhale. 8 more. 7. 6, 5, 4, 3, 2, last one, my friends, and 1. Well done. You're going to feel that on your lower abs and your quads and your hip flexors. Now we are progressing. Now with your right leg up, toes pointing the ceiling, lock your knees, and then we're going to do small circle like a size of a small dish. As I do circles, I don't want to do it too fast. I want to keep my spine stable so I don't hurt my back. I'm squeezing my core in. Inhale and exhale. 5 more. 4, 3, 2, and 1. And then reverse circles counterclockwise. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. So we have our toes pointing to the ceiling. Now we're going to challenge by dorsiflexing. You're going to feel a beautiful stretch on your calf and your hamstrings. So the purpose of this is to really control your lower abs. If it's this is too tiring, you can pause and turn off the video and then resume it whenever you're ready. Making sure you can tolerate continuous flow. 10, slow and steady. You're going to feel shakiness now in your leg. 9, 8, don't forget your breath work. 6, 5, 4, 3, 2, and 1. And now we're gonna reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, last one, and 1, and down. You're gonna feel the fatigue, you're gonna feel shakiness, and that's how you know you're really engaging your muscles. Now let's switch to the other side. Keep the other knee bent to protect your spine. Toes pointed to your ceiling first. You can place your hand on your abdomen so you can really feel the core engagement, and belly, core engagement with your belly breath, your deep breathing. 5, 4, small circles. 2, and 1, and then reverse circles. 10, you can feel a lovely stretch. 9, 8, 7, 6, 5, slow and steady. 4, 3, 2, and 1. And now we progress with dorsiflex. Toes pointing, you feel that stretch on your calf and your hamstrings, and circle again counterclockwise. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And then reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And down. Well done. Now we are progressing. If you can't continue further, that's fine. For those who can still continue, join me. Knees bent to your chest, hug them by placing your hands behind your thighs, then slowly extend your knees if you can, as long as there's no increasing pain. So toes pointing away, we're gonna do double circles. You can hold on behind your thighs if you'd like, but if you want a challenge, you can let go for those who can. And then double circles. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And then reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Now dorsiflex. Point your toes towards you, and then let's go reverse clockwise. 10, 9, 8, slow and steady, 7. Don't rock your hips, control, don't twist your spine, 5, 4, 3, 2, and 1, and then reverse circles, 10. We're almost done, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Now hug behind your thighs, hold it there for support, lock your knees if you can, and then we're going to do V-stretch. We're going to separate your feet apart with your toes pointing towards you. So we're going to slowly stretch your inner thighs. You can hold on if you need to. As you inhale, exhale, tippy toes, away your toes before you place your feet together in the center, pointing to the heavens. Now, if you want to challenge, let go and join me. So dorsiflex, toes pointing you before lowering, separating your legs apart. Inhale, exhale, toes pointing away before going center. Inhale, exhale, center. 8 more. 7, 6, 5, 4, 3, we're almost done, my friends. 2, and 1. Well done. Knees bent down to your chest. We're gonna cool down now. Hug your knees, interlock your fingers, knees to chest, and then you're gonna rock side to side, feeling good on your back, your core, and your hips. Breathe in and breathe out. And now we'll do circles by rocking your knees to your chest. And then reverse circles. Now lower your feet down. As I said, if you have one side low back pain, if your pain is in your left side, place your hands beside you, palms up, elbows bent, and then you're gonna lower away from your painful side. Lower both knees to the right, and then turn your head to the left. Inhale, exhale for at least 3 deep breaths. Now let's switch the other side. Lower both knees to the left and turn your head to the right. And now we'll do figure 4 stretch. Place your ankle. Let's start with your right. If your problem side is your right side, start with that. Ankle on top of your thigh. Press your knee out and figure 4. Stretch your hips. Inhale. Exhale. Pull. Slow and steady. Inhale. Open. Exhale. Pull. 2 more. Last one. And hold it in 5, 4, 3, 2, and 1. And then switch to the other side. Left ankle over your thigh. Press out first. Inhale. Exhale in. 4 more. Feels good on your hips. 2 more. Inhale out. Exhale in. Last one. Inhale and exhale. And that's it. I'm hoping you enjoyed my lovely core, deep core activation to help your core muscles to get stronger and healthier, as well as if you have one-sided pain, to really balance your body. And to balance it out, you have to do on both sides. And if you want to stretch extra, do an extra repetition on the weaker side where you have the pain to stretch it out if you have spasms on that area. If you love my video and want to learn more about Pilates, yoga, physical therapy, health, and wellness, please subscribe to my channel. Ring the bell so you won't miss anything. Like and share this video. Every like you give to my channel, you are supporting me. And as I said earlier, if you need my guidance, support, and special hand-in-hand coaching, you can click the link on my description below and be part of my early bird waitlist for a first-come, first-served basis of my back masterclass. I'm so excited for those who already signed up. And if you want to learn more about it, there's a free 6-part video series. You can learn more about what is core and back immersion therapy, and you will receive it through email on how to learn and get free access on the 6 videos to learn more about the program. And I also have another course I'm gonna launch very soon for those with postpartum, weak pelvic floor, and anyone with diastasis recti, umbilical hernia, revive pelvic floor health. Click the link on the description below and be part of the early bird waitlist for those absolute beginners. And if you have a quadratus lumborum pain, which is a one-side weakness, check out these videos to learn more if you have this spasm tightness on one side of your back. Watch this video, and if you have umbilical hernia and you need a simple program to really jumpstart to strengthen your core safely and effectively, watch this video. Until my next video training, always remember, be safe, be well, and healthy you. Bye!